let's go back again. We just recap for the ones joining us a little bit late of what is happening to the aesthetic market. And as we see is this new, obviously, generation, the new millennium or Generation Y, are actually really seeking for treatments to enhance their inner beauty. So more natural, more preventative treatments, which actually represents, that we've been talking about, a real challenge for all of us, because we want to respect their anatomy and to grow through the years with us sculpting the faces and maintaining a very youthful, natural look. So lips, as we've seen, is one of the first things they're asking for when they start on the fillers market. Of course, toxin when they're young is of course important. And then later on, when they start becoming a little bit more mature, or there are some beginning changes of aging, then we start looking obviously at cheekbones, etc. And as we can see on the next slide, there are fantastic on their phones. They know all of it. They know how to apply these filters, how to use these photos to create those right angles on the selfish. And I think they work obviously a lot on following things on Instagram, Facebook, etc. And if we look from the American Medical Association, and the photo editing is one of the biggest things. So they are applying these filters in majority of the cases, so they can create that perfect look they're looking for. And when they come to see us this time, they're not saying, I want to have the lips of Angelina Jolie anymore. What they're saying is, I want my lips, but I want them to look like this. And this is, as I said, a challenge. So we can see on our first video. Do we have the next one, a video?
Almost all plastic surgeons will tell you that they are seeing patients coming younger. Hi, my name is Mira Salim. 2 weeks from now, I'm about to have nose surgery. When I get my nose done, I'll be able to take more pictures that I'd want to take. I knew that I wanted my nose fixed. There's less guilt about undergoing procedures. 5 or 10 years ago, people might have brought in the picture of a magazine cover supermodel. Now they're bringing in a picture of themselves, but just in a slightly optimized way, where Facetune or a Snapchat filter will give them a millimeter more of a cheekbone projection, or a fuller lip, or a straighter nose. It represents a healthier version of body image. Nobody is going to look like they have an Instagram sparkle filter on them all the time. Got it.
And this is obviously been the challenge. So it's actually because we know that they want those natural results. So we want to create this concept. So at the moment, we want to call it Be You, beautiful. So it's be yourself, but better. And of course, it's the new era on the Instagram where they call it the beauty grammars. So if we look at the next slide, is obviously what Ricardo has been mentioning already. What can we do, or what have we brought to you to bring this new concept of MYVOLUTION? And I think we got another video to follow.
The way we look on social networks or apps is so stunning. It's the beauty grandmas era. Today, millennials take on average 10 selfies every 10 seconds on Instagram. Yes, indeed, selfies have become the tool to show ourselves at our best.
We study the morphology of thousands of faces. We have noticed there are 3 main facial shapes: triangular, round, and rectangular. Each shape has got different areas of lights and shadows. We found letters, which correspond to each shape: M, Y, B. When I modify the volume in the areas indicated by these letters, the light and shadows become modified. Of course, every person has authentic beauty, but if we work on facial volume, we can highlight their beauty even more. Beauty is already there. We let it show.
So how can we transform our favorite digital image into reality? IBSA introduces Aliexin MYVOLUTION. Aliexin MYVOLUTION is an innovative approach that turns your 2D image into a real 3D one. By volumizing it with hyaluronic acid, Aliexin MYVOLUTION releases your enhanced authentic beauty. AliexIn MYVOLUTIon. Show your 3D beauty.
Thank you. So really, in conclusion, is obviously an innovation, is something to try to approach beauty in this new different way. And as we can see on the next slide, is just bringing from the video, the key points will be to actually move from a digital 2D image to actually a real 3D image, which actually reflects what you will try to achieve with those filters, but actually you wouldn't have to apply them because your 3D image will be so much more enhanced and sophisticated. So the whole concept, and I'm going to pass this to Ricardo now, is to actually keep that natural look and use minimum amount of product to achieve this.
Yes, this is a big challenge, even if, above all, because when it comes to small amount, we have to be very, very precise, and we have to be very effective in our, modifications on the face. So, as the filter engineer told us in the video, the digital filters works in this way. It analyzes the face, and it recognizes a specific facial shape, and then the filter applies different algorithms to different shapes in order to highlight some specific areas of the face that can enhance the beauty and the light on the face. So this is what the digital filter does. So how can we transfer all this in reality? So we worked on this digital algorithm, and we found that we can see in the next slide that each facial shape can be approached by fillers injecting in some specific points that are the most effective points to enhance beauty on this face. And in particular, for triangular shape, we have a serial of points that draws an M on the face. On round, we can draw a Y with these points, and on the rectangular shape, we can draw a V on the face. So let's go on and let's analyze every single shape. So triangular facial shape, M approach. So the triangular shape is the one that more represent the ideal, of beauty. So very often on these faces we have to do very little things. But what is actually complaining usually a lady with a triangular face? She complains maybe that she looks too thin, that she's maybe missing a little bit of shape in the mandibular line. So of course the patient tell us which are her needs, but we have to then translate it into anatomical points. So which are the products that we can choose in this case? So we approach the face with AliexIn SV for sculpting and remodeling the bone profile. We choose AliexIn EV for contouring and to interact with the fat compartments, and of course AliexIn LV for the lip sculpting. So you see the before, you see the triangle that is the facial shape, and the M that is the serial points that we have to work on. So let's go and see the video. So now I am drawing my points on the face with a pen, and you see I am working. First of all, in this case, she is missing a little bit the anterior projection of the zygomatic arch, and this is affecting a little bit the cranial part of the nasolabial fold that is a little bit too much depressed. And so And of course, in the triangular face, a little bit of the projection of the mandibular angle is missing. So these are the points that that describes the M approach on the triangular face. So Beatrice, maybe you want to add something about the triangular shape of the face.
You're right, is one of the common ones. And like you say, one of the most common factors will be, of course, and they are a little bit narrow here. And with obviously the younger patients, because everything else is strong, so the skin is still not lax. It's easy to use these products with the big G prime like SV to actually project and give a shape with very small amounts of product. So I totally agree. And of course, if they're a little bit too flat, then you can use EV to maybe work into the fat pads, and in that way you can contour at the same time. But again, with the small amounts, because these patients are young, so the elasticity is still in their best.
Yes, it's true. So it's very important to have a good balance between the changing that we are creating on the face and the natural and balanced look of the face. So there's no need in a younger lady to inject big amounts, but it is very important that the filler that we inject is able to perform the action that we want to represent. So if I'm injecting to project the anterior part of the zygomatic arch, I need a filler that keeps the roundness of the bolus. So I need a filler that doesn't collapse and doesn't flatten down when the patient moves or when the patient lies on the pillows. So the projection has to stay there. So you can see now the different behavior of the two sides of the face on the video. So sculpting, elevating the fat compartments, not enlarging. We are elevating the fat compartment. So it's a very different action. So it's not enough to inject volume to obtain the result we need. Because if I inject a soft gel along the zygomatic arch, I create a rounder, a more round zygomatic arch. And this is not what we want in this case, because too much roundness is creating not a focused light, it's not sculpting the light, it's not elevating the fat compartments, it's just creating roundness that makes weight on the face and make you lose definition and projection. So you see, very effective. The amounts that I injected here are very low, 1.1 ml per side of SV, 0.5 as in the mandibular angle of SV, and 1 ml of Aliaxin LV in the lips. So really the total amount for a total, for a complete remodeling of the face is 4.2 ml. So if we compare it with big implants that we were used to do, or we have been told to do, you know, in different approaches, this is a very small amount that means safe, means affordable, means easy to perform, and you know, effective. So you want to add something, Beth?
And it's a beautiful lady, but we have created even a better result. I mean, you've done a great job. It's really great. We're playing with those light and shadows. Like we're saying, we're trying to reflect the light and to get that sharpness and contouring, which we can really appreciate on the photo. And I think it's a great job. So yeah, very.
Yeah, and this is what you see on the photos, because remember, we have to remember that our patient, they don't look at themselves in the mirror. They look at themselves in the mobile, in the selfies, and the digital image flattens the face very often. So we need an enhanced three-dimensionality. We need the 3D effect in order to obtain the better performance in digital picture. So this is what we have been asked very often from our patients. I think it's the same for you, Beatrice. They just come with their selfies, you know, and they comment it.
Absolutely. And they go, oh, when I do my makeup as well, the same that you think when you do with your highlighter and contouring is what they're trying to do with those filters. So they do it on their phone and then they really believe that's how they look, but actually they don't. So they post that to everyone. And yeah, it's a bit of a disappointment. So they're looking really to achieve. I think on the next slide, we can probably see very well what we're trying to say, because most people will take in an angle their photo, maybe not so much in this angle.
True.
But just to create that particularly the shape of the cheekbones and the cheeks, but the balance of the rest of the face, because you're trying to balance the lip projection to the size of the nose, the chin projection, the jawline. So all of that is being taken into account when we analyze the shape of the face, and we choose these specific injection points to actually work on there.
Yeah, I think it's quite clear that you can see the M drawn by the lights on the face. You know, you see that the M that we followed in the injection, really, it creates this new diffusion of the light. So I think, you know, this is very
good.
And this is a nice, a good challenge, because we try to take the before, the picture of the before, and apply a moderate filter, a moderate filler with a very diffused application for mobiles that is face up, and see what face up would have been doing on this face. And you know, you see the smoothing of the lights. Of course, she looks better with the filter, but with the MYVOLUTION approach, I think that the 3D effect is even more appreciable, and it's, you know, the enhancement of the balancing of the parameters on the face is more effective than the digital filter that is, you know, even more flattening the face. What do you think?
Oh, absolutely, because we're creating that real, I think we're becoming like a sculptors, and we're definitely using that sort of flair for beauty to actually to use those key points. And I think that's why it's so difficult to work on young people. Very, very challenging for us.
Okay, let's go on and see the approach with the round face. This is actually the hardest challenge for us, because in round faces, we have excess of volumes most of the time. So how can we correct excess of volume with volume? It seems like, you know, it is not working. But, and let's say, what is a round-faced lady complaining of? She complains that she looks fat, that she looks heavy on the face, that the light on her face is flat and is, you know, is boring, but most of the time they want to look thinner. So how can we sculpt this face in order to obtain a thinner look and more elevating, sculpted and defined contour? So the approach is DY. So we have to enhance the projection of chin, lips, nasolabial fold, and then sculpt the higher part of the cheekbones in order to move the volumes from the central part of the cheeks and move the volume up on the zygomatic arch. The products are SV for projection, EV for contouring and, you know, softening, and LV for the lips. So let's go on in the next slide. We see a classical young, she's 23, she's one of my patients. She has this round face. She is not fat at all, but she has this fatty face that she really doesn't like, because everybody's asking her, did you gain weight? You know, she's really, you know, she's really conditioned by this thing. So we see the round shape and the Y approach. So let's go on and see the video. So I mark the medial line, and then we mark the upper border of the zygomatic arch. So this is the area that we have to sculpt. We have to move the light from the rest of the face and concentrate the light in these areas. And it is mandatory in this case to have a filler with a very high G prime, because we have to avoid the risk that the volume spreads around, that creates roundness or softness, because we have an excess of roundness and softness. So sculpting and elevating is the main action in this case, and the gel has to perform this kind of action. Otherwise, the result is going to be a disaster. We make it worse and worse. Do you agree, Beatrice?
Absolutely. We remember as well that video which you went online quite viral about that aging phase, where you got the more round when you're a baby, and then you obviously start contouring through your teens, and then it starts in your 30s, and then suddenly when we get older again, we collapse the face again, so we're still got more round face. So the problem with round faces is makes you look also a lot younger. They don't look so sophisticated, so contour. And I think that's why it's a challenge. And like Ricardo said, is to try to sculpt this face and give it a shape is much more difficult than in the previous case we've seen with the obviously more elongated face.
Yes, the triangular shape is really helping us, because, as I said before, is closer to the ideal beauty, you know. But round, really, working, as I said before, working with volumes in a face that has an excess, that has too much volume, this is really a big challenge. But sculpting bone profiles and moving, elevating the volume from the cheek up to the diaphragmatic arch, this really create a different balance between light and shadows. And we will see in the picture of the result that it's obvious that she looks more defined, the contours are more precise, and the volume is not in excess anymore. So now you saw in the video before that they injected the Aliaxin SV with the needle deep on the bone in the chin. But this is not enough, because in this way you sculpt the bone profile, but then I need the EV with the cannula to contour a little bit the chin and create the nice diffusion of light, because I want it sharper but not too sharp. So contouring and sculpting is actually very important. So let's go to the slide with the picture of the before and after.
And I think it's very impressive that with such a small amount of product, you can actually recreate the face and change so dramatically. I think for me, from all the cases, this is probably the most powerful, because it's the most difficult one to deal with.
Yes, I agree. And if we look at the total quantity that has been injected, 3.5 ml, I mean, it's really, I must say, ridiculous. But as we said, and I never get tired of repeating it, we have in this case an excess of volume. So we must inject very small amount, but very effective. So this is the key. Small quantities, big effect. So G prime has to be the right one to be able to support the weight of the cheeks and being able to elevate the cheeks. So if we lose this action, we won't get any result, but we only increase the volume of the cheeks. That is what the patient doesn't want, absolutely. So actually, especially in this case, as Beatrice said, that is the most difficult, is very important that the tools that we are using are able to perform the action that we want to sculpt on this face. And this is the real evidence of how we apply the rheology into practice. So we said in the previous webinar that we have to put rheology into practice. I think this is the perfect explanation of this contest.
Yeah, using the higher G prime for that sort of projection, and obviously the softer fillers when you want to then contour and mold the face to create this beautiful profile where actually, like you said earlier, it looks like she's lost weight as number one, but also like she's more sophisticated, like she's grown up.
Yeah, yes, true, absolutely true. So it's more emotional than anatomical, you know. This is actually very important because they want, you know, they want emotions, actually.
Absolutely.
So this is again, we tried with the filter to see what the filter could do on the picture, and of course the filter is able to smoothen the lights, is able to create you know, a nicer skin, everything looks better, but the sculpting effect, the elevating effect, the thinning effect that the MYVOLUTION approach is able to perform, I think is in this case is unique. And also the lips, look, just working on the vertical diameter, not volume, not reshaping, just height. The height of the lips has been a little bit improved.
Absolutely.
Because the medial line is very important in this case. So the last, rectangular facial shape, what are the complainings of these patients? Very often they say, my face is too severe, or sometimes it is too masculine. I'm missing a little bit of softness. I'm missing a little bit of, you know, something that reminds more of sweetness in the face. So they are a little bit, you know, the hardness of the profile is affecting the emotional part of these faces. Do you want to add something, Beatrice, maybe?
No, I think you're right. And it is maybe less commonly seen, but of course, because they've got a very, very heavy square face, they don't really have that sort of ability to use the filters so well for them, because obviously the lights, like you said earlier, will obviously give them a better skin or may take a little bit of the shadows, but it will never give them that real 3D effect. So it's a good challenge, this one. And I think as we can see on this slide, using the V with those key points, you will agree that actually we suddenly invert the rectangle into more a V again, and we're working on that shape to enhance those features. Yeah, so let's say that the rectangular shape and the triangular shape, they have to meet in a middle point, you know, because we need a little bit of both. And so this is a typical rectangular face, and you know, you see the severe atmosphere of the face. They say, everybody's asking me if I'm angry or if I'm sad, because you know, sometimes these sharp shadows on this face are affecting a little bit the emotional message that the face is giving to the others. So the V approach is meant to soften this excess of bone definition, and is meant to create softness, to smoothen the temporal groove and the masseter groove, and create a more homogeneous and softer light on the face, still keeping nice projection on the chin, a nice projection on the cheekbones, just smoothening a little bit the sharpness. So let's go to the video and see how we draw the V. The V starts from the chin and then moves up to the temporal area, and the upper part of the V enlarges a little bit, embracing, hugging the zygomatic arch in order to smoothen the excess of projection of the bone profiles on these faces. So it's clear that when it comes to softening and smoothening, the gel that is more represented, more
used in this kind of implant is a gel with the medium G prime that is able to act as fat compartments, you know. So SV can help us a little bit in sculpting the chin. I'm injecting down the SV with the needle right on the periosteum because I need the vertex of the V to be well represented. So sculpting the bone, but then it will be mandatory to smoothen this projection with the EV, with the cannula, and we will see in the video how we can, you know, we can perform it. So with the SV, I'm still helping, you know, the medial central part of the zygomatic arch to elevate and support the soft tissue, because this area gives a very strong impact to the lights of the face. So I always like to improve this point. I remember you that the injection with the needle on the periosteum has to be slow, because we are stretching muscle insertion and the ligament, so this can provoke a little bit of burning feeling. So inject slowly, take time, make the patient relax. You know, now I'm stretching upward a little bit the ligament, I'm positioning the gel below the ligament in order to help the ligament to stay up.
Yes, and I agree with you. It has to be very slow injection because it is uncomfortable when you're placing the product in that area. But also because when you're injecting it slowly, you can visualize the changes on the skin, because actually you can see the tissue lifting, isn't it, Ricardo, with this type of product?
Yes, yes, absolutely. You see it and you adapt the volume to the action. So really, you see the dynamic movement of the tissue following the forces that are developed from the filler that is taking place into the tissue. So really is a step-by-step sculpting effect, and you modulate it depending for what you see on the face. So actually you are agree, inject, observe, evaluate, inject again, observe, inject, observe, inject. So it's really step by step, like you are modeling, you know, a sculpture.
And of course, we have to remember that every person is individual, and we are personalizing these treatments for them. There are sometimes, obviously, patients where they will have an asymmetry. So again, we have to adapt to that by putting maybe more volume in one side than the other. So it's not injecting by numbers. We cannot tell you in every point you're going to put 0.1 or 0.2, because like Ricardo said, you have to watch, visualize, and adapt to that patient to create exactly what you need. And when we look at the lower parts of the face, particularly on this area of the marionette towards the chin, and obviously if someone is very retrograde in there and you're enhancing it, you're going to blend it in a way to work with the chin projection and also the lip projection, because sometimes if we only do a lip and we exaggerate it a little bit and we don't work with the rest of the face around, we may end putting a lip which doesn't belong to that face, because suddenly, for very beautiful the lips look as an individual module, it doesn't fit or doesn't balance to the rest of the face. So this is why Ricardo is always working around. We can see that it's like the obviously the marionette, your chin area, all have to blend, so you get that beautiful three-dimensional effect, which obviously is very beautiful.
Yeah, thank you, Beatrice. Yes, this is the point. And you said another very important thing, actually. We are giving a good guideline for approaching these phases, but it's mandatory the personalization. So we don't give fixed point and fixed amount, absolutely not. This is a very powerful communication tool between doctor and patient, and gives the right direction to the operator to identify the strategical points, but everything has to be adapted to personality and anatomy of the patient, the wishes of the patient, you know. So Of course, the last choice is in the hands of the doctor, of the operator that, you know, has to adapt the acknowledgement to the specific case.
And we need to remember that these patients, once they come to us and they love what you've done for them, they're going to be with us for many, many years. So we're going to follow the whole aging process, which actually is very exciting for us as doctors, because we're actually really giving them what they're looking for. And I love this type of challenges. And I think it's amazing that now we got the ability to treat the younger patients, because before it used to be a little bit of a taboo. It's like if you treated someone in their late 20s or early 30s, everyone would go, oh, wow, but they don't need it. Well, that's what we're thinking here, emotionally, and how they feel about themselves. These new generations do need this, and they're seeking these treatments, and they're looking for it. So we need to adapt, and I think we need to give one step. We need to grow a little bit and challenge ourselves, because obviously it's not easy.
Yeah, it's true. I mean, in millennials, they really have to trust their appearance, because the aesthetic message today, because of the, you know, the social platforms on the web and you know, all these things, they really strongly need to trust their appearance. They make them self-confident. So actually, it is very important to support this side of their expectations and of their feelings. So, and as you said, this is the best way to fidelize the patient. The patient won't ever leave you when you are able to communicate with her in the language she's able to understand. So this is actually extremely important. So the total amount in this case is 5 ml. As I said before, the EV is in this case working very well in smoothing, and you see the temporal groove has been smoothened a little bit. The sharpness of the zygomatic arch has been molded a little bit, and look at the chin. The chin was square, was rectangular. There was, you know, there were shadows affecting the definition of the contour of the face, and in the after you see the light on the chin and the lips, and she seems like she's smiling a little bit. So the severe atmosphere has been moved into a relaxed and, you know, and very I don't know how to say. She looks like she's feeling very well. You know, she's transmitting.
Calm, isn't it? Calmer.
Calm, yeah, yes, true. I couldn't find the word.
Very
so,
elegant.
And then the masseter area, you see, has been smoothened a little bit, the temporal groove. And so I think also the lateral view is clear, which is the aim of this kind of implant. So let's go on.
So in conclusion then, to be able to work on MYVOLUTION, just to recap, these are the 3 key products we are working with. So SV, again, that's your bigger volumizer. So that's the one with the bigger G prime. So it's going to be the one we use for that projection and that sort of lifting on an older patient. EV in the middle, and of course LV for the lips. And as we can see from we've seen on the videos on the previous talk, we can use it either with needle or with cannula, because the flowability of the product is very easy. You can inject very easily. The extrusion force is very comfortable, and you can adapt your techniques depending on obviously the results the patients are looking for. So really, in conclusion, if we go to the next slide, is we want to actually try to find out how can we obviously help everyone to bring the concept of MYVOLUTION into the clinics.
So what IPSA want to do is give to doctors, to our colleagues, a fantastic support for practical application of MYVOLUTION into our practice. So they developed an application for mobiles, so for tablets, that is able to help you in facial analysis and shows you how to recognize different shapes of face and increase the communication between doctor and patient in the way that you can show, you can educate the patient that we can work in a very different way in order to achieve the result that she is emotionally asking for, you know. So this is how the application appears. Let's go to the next slide. You have to look for IPSA MYVOLUTION in your App Store or Play Store application and download it. Then you see you have two possibilities. You go into the info of the application or go into the medical suite. So you go into the medical suite and then you start using the face analyzer. And just to start using it, you can ask to the Ipsaderma booth some privileged access for the app, and then you have 1 month to insert, to subscribe with your own account, with your own password. So let's go to the next step. So when you start the face analyzer, you have to take a picture of the patient. Of course, the light has to be optimized, and you have to center the face into the round circle that you have on the screen. You take the picture, and then you have to help the app in positioning some strategic points on the face in order to allow the app, the face analyzer, to recognize more precisely the shape of the face. After you take the picture and the face analyzer gives you the shape of the face, you can decide to save the picture on your mobile, in your gallery, in order to then have the possibility of comparing with the result you obtain. Let's go to the next picture. So after the analysis of the facial shape, the app suggests you the recommended approach. In this case, the face is rectangular, so the V approach would be the recommended, and also the app suggests you which are the right products to apply, to use, to create the V approach. So this is something very easy to use, something very helpful in discussing the approach with the patient, and I think it will be a nice tool to play with, and it will really help us a lot in our daily practice. So Beatrice, we want to add something?
No, I think it would be a great way of communicating with this young generation, what you're trying to achieve, because it's a way to explain it. Because of course, it's very hard to show them because it's all in photographs and it's all flat images. So having the face analyzer and indicating the points of injection, it could help us as well to communicate with the youngsters.
So I think we are in the end of our presentation. We have a video now. No, we have a video, that is showing the app.
I think that's just repeating it now, isn't it? So in conclusion, we are really looking for a new way to approach beauty for the new millennials. And of course, what we are trying to do, as we've been saying, is to move from the 2D images to actually a real 3D image. And we're doing that by analyzing each face into obviously a triangular, a round, or a rectangular face with MYVOLUTION approach. So M, Y, and V. So it's very easy to remember. And it's working with volumes to create light and shadows, but with a very natural result, respecting the anatomy and enhancing inner beauty without obviously going too over the top, too dramatically. So yeah, I think in a way, I'm hoping that we can all show our 3D beauty with this new concept. And I hope you have enjoyed the presentation today. And I'm sure there will be some questions for Ricardo and myself in a minute.
Yes,
So thank you.
Yes, Beatrice. Yes, Ricardo, first of all, thank you very much for your amazing speech. Yes, we have 5 minutes for question. There is one very interesting, the last one, if this approach can be applied to older people or it's only for millennials. So feel free to answer to this question and we will jump to some, let's say, leap question.
Okay, I give my answer. Maybe then Beatrice can add something. So I think that this approach can be applied to every patient. It doesn't matter for the age because it helps in approaching a certain facial shape and tell us how to improve beauty. Of course, this is not enough on aged patients with aging signs, because then we have to concentrate also in correcting the aging signs like wrinkles, folds, you know, and the loss of fat compartments volume. So it has to be integrated with other techniques, but I think it's a very good basis to start with also in aged patients.
Totally agree. I think it makes very simple because having a face shape, you know then what you're looking to achieve. Like Ricardo said, the only problem when you got the more mature patients, because of the signs of aging, you're going to have to work at different levels and maybe with more amount of product. But at the end of the day, we are all still recreating that heart-shaped face, which is what is supposed to look more, obviously more attractive in most of the cultures and different races. So it doesn't really matter. It's not just Caucasian faces. So we're all looking to achieve that sort of heart shape. And I think the focus, if you go in aging face, may start most naturally on mid face, and then you may move later to a lower face. And of course, it's still that central part. So you still got the same points of working. Yes.
Yes, thank you, Beatrice. Thank you, Ricardo. They're asking if you have some trick when you have hematoma on the lips.
If we
Patient.
Yeah. I know it's for lucky, but after that you have an hematoma, what is your approach?
Beatrice, you want to answer?
Yeah, of course. I mean, the most important thing is probably to see it straight away that it's happened. So if you spot it quickly, we apply pressure, and of course we use ice packs in our clinic. If you maintain the pressure long enough and maintain ice packs, hopefully you minimize the damage. The problem is when you don't spot it and they go home and they carry on bleeding and they are a bit longer. So it's a little bit harder then, because of course it's set. I don't know. Do you do anything different, Ricardo?
No, I absolutely agree. So if you see it immediately, as you said, pressure compression is the more helpful action. Just stay there for a couple of minutes with compression on the sides, and this will reduce the impact of the bruising or the hematoma. And when it happens, when it occurs in the day after or the morning after, this is a little bit more, affecting the patient, and our control in the development of the bruising is less. There are some products that we can suggest, of course, this is that, but it takes time, 4, 5, 6, 7 days sometimes. We have to warn the patient before, we have to deal with it, but sometimes we can't do anything about it.
Yes. I think it's important in your consent form to say there is a risk, particularly working on the lips and particularly working with a sharp needle, because of the variabilities we had on anatomy, and we don't know exactly where the blood vessel is. So we wish it was always deep, but sometimes it's not. So, but yeah, it's trying. But if you are slow and gentle, it's less likely. But it will happen to all of us, unfortunately, because the more you use the needle and the more times you put it in someone's face, the more likely you're going to hit one day one of those blood vessels.
And if the patient is really worried about bruising, we can choose the cannula, because this, of course, will help us. So with the cannula, as Beatrice before said very clearly, some actions, some effect on the lips you're not able to create them, but still you can have very nice lips, very good volumizing effect, and you reduce a lot the risk of hematomas and bruising.
Perfectly. I really thank you for the amazing speech, and please enjoy our first virtual congress. Thank you very much to everybody.
Thank you, everyone.
Thank you. Bye-bye.
Bye.